tell me what we're up to today, Devin?
We're driving to the Freedom Center, which is based in Haralson County, Georgia. They're a recovery organization that focuses on holistic recovery.
We have found these counties that we want to talk to who have been hit hard with the opioid crisis, and kind of look at the community, the enormous efforts that have been put in to kind of combat that, and the strengths that the community has been able to kind of come together and kind of listen to your stories and talk about next steps and kind of building up this effort.
Our philosophy here pretty much is, like I said, anybody walks through the door, we try to help them. And that's a struggle. And I think through my career here, I have seen an increase in substance use and an increase in mental illness, and I have seen a gradual decrease in services. We've kind of fallen through the cracks. We have people, that come in that have no money, and they have serious problems. And we really try to extend ourselves to help those people. And we struggle. I mean, we really struggle with funding. But we're here every day. We've been here. We continue to be here. And Shanna might speak a little more about it, but we care and we try.
I absolutely do. One of the things, people come in crisis, and they're legitimately in crisis. We don't have anywhere to send them. And when I look at this wall of people in recovery, I can tell you that 50% of those have had some kind of setback. And I can tell you that 25% of those with setbacks have not reached out for further treatment. Now, it doesn't mean they're never going to come back in. But every one of those people have children. They have families. They're not just a picture on a wall to us. We know them all.
And I've worked here, for 40 years, and we've had more overdoses in Union County in the last 5 years, more than the total of all previous years. I mean, it's just, we didn't ever used to hear of someone overdosing, and now it's almost common. It's almost like weekly.
Thank you. Yeah, I don't know. It's like, are you the best person to give this stuff to? And then this was the other thing I talked about that we have just gathered along the road from other people. But this is the 8 milligram Narcan.
Okay.
I think it's 2 doses, and then this is just the usual. I
That's
think
what we have,
nasal spray,
Right.
and then 2 of the.
We actually have a unique position because we are in the school systems. And when we go in and teach them, we are at our public charter school. We get to go in there 2 times a week and teach. What happens if you're riding a bike and you fall off of it and you break your leg? Well, your parents are addicts. So you already have a higher risk of becoming an addict yourself. Say you start taking those pain pills and all of a sudden you became addicted to it. We try to give them a understanding and a look into addiction before it happens, so maybe that gives them a little bit more compassion to what's going on. And we have kids come to us, and it's really sad, and say, I'm abusing cough syrup because my anxiety medication's not working, but my family, we don't talk about feelings in my family. So then we have to start with them, and try to kind of coach and guide them. Well, maybe you open the conversation for your parents. Well, maybe here's the easy question you can take to your parents.
So that's 8, 10, 11-year-olds.
Yeah, they're super young.
And most of the time it's because it's at home.
Yeah.
It's easily accessible. And now, one of our high schools, and we have 5.
Yeah.
One of our high schools had 26 overdoses and 6 suicide attempts last school year. That's not even the school where the kids who have gotten in trouble for things like substances is. It's just really prevalent in the community, and it's really sad to watch. You know, these young folks see it, and you know they hate it because their lives, they're suffering because of it, not having proper nutrition or electricity or hot water and things like that because their family's involved in it, and sometimes it's multi-generational. And then because that's what everybody does, they grow up and do the same thing to avoid feeling the despair of that, or to spend time with their family even.
I've tried.
What led you to being here where you are right now?
The problem found me. I didn't find the problem. A lot of people ask, have you had your own experience, lived experience in your own recovery? No. At the time in Wilkes County, I was the chaplain and the director for our hospice program. So I was dealing and working with end-of-life care for the families in Wilkes, and we had prescription issues. And that's when I started to notice that there's an issue here, because I have prescribers saying I can't write prescriptions for narcotics to that person in that home because it keeps disappearing. So then I started to ask questions, and we found people selling it, stealing it, sharing it, and then realized how bad the overdose situation was when nobody was even talking about it, and essentially just chased that rabbit.
And what is the use overdose situation like here?
It's down quite a bit from where it was, and it's like a roller coaster. Every year, some go up and then it goes down again. Unfortunately, in North Carolina with fentanyl, it has spiked back up again, and so that's a whole different animal than prescription opioids. But I said in 2010, I said, if you put the kibosh on prescription opioids, something's going to take its place. You can't just deal with the supply of something. You have to work with the demand. There is stigma. And the stigma is, well, if you chose to use that stuff, then you can choose not to. It's not that simple. And I've been all over the United States, Canada, many places, and I ask the question all the time, somebody raise your hand if you ever chose to get addicted. Not one person has ever raised their hand. It's not a choice, it happens. Addiction chooses somebody every day.
There was a level of uncertainty, especially going into an area where we are coming from a university and research, and these are small communities that we don't know the life they live every single day. And it was definitely, I went into it, and I think Devlin can also agree, went into it in the more of a learning and / we want to learn about your community and how it's been affected and what are the organizations that are working to kind of bring it back together type of situation. That's kind of the perspective I went into it, and everyone not only was so welcoming towards us, but also in having that conversation with us and being really honest in both negative and positive aspects of the work they were doing. So I think that was really eye-opening and thinking about next steps into not only going to those counties again specifically, but also thinking about how we can develop the project further.
When we got there and started listening, they could see that we cared, and that actually showed a lot of, kind of improved our chances of getting people to work with us. But then, as we've been here, one constant theme that we've had is not feeling like we have enough time to really learn about these communities in depth. And so we've been talking about going back, or including more counties as we go in the next trip, and I think that's a really great outcome too. So we can define success for this trip, but also it opens a new doorway to go again.